He's a 54-year-old male complaining of pain for a couple months in the right shoulder, no injury. Exam, not very impressive, except for some pain with some elevation, basic impingement kind of syndrome, not much weakness with resisted motion. It's been going on again for a couple months, partially responsive to therapy. So we're going to take a little deeper look at the shoulder.
Here we're looking at the biceps tendon. This is basically our home base view. You can see the biceps tendon sitting between the greater and the lesser tuberosities. You can see the subscapularis tendon, but it's black, secondary to anisotropy. Here again is the biceps tendon. We're going a little bit higher up, and the biceps tendon is starting to curve towards the glenoid, so we see it as an ovoid, oblique-ish kind of structure at this point. Now we're even going closer towards the supraglenoid tubercle, and the biceps tendon again is curving, so we have to curve our probe with it in order to maintain that round ovoid structure in short axis. Now we're looking at the biceps tendon in long axis. You can see this nice fibular texture, strandy structure going distally into the muscle, which you can see here. And the muscle is labeled number 5. Again, this is the beginning of the biceps brachii muscle, long head. The large muscle superficial to that is the deltoid muscle. Now we're going to look at the subscapularis tendon. We can see it in long axis, basically attaching to the lesser tuberosity, essentially normal looking tendon here, and now we're having the patient internally and externally rotate. You can see the subscapularis tendon gliding underneath the coracoid process. Sometimes you can get a subcoracoid bursitis in this region when the tendon gets impinged under the coracoid. Also note the thin hyperechoic tissue by the coracoid, which are the origin of the short head of the biceps tendon and the coracobrachialis muscle. Now we're going to look at the subscapularis tendon in short axis. Again, pretty normal looking tendon. There are some muscles that interdigitate pretty distally into the tendon. And here we're actually looking at the rotator cuff interval. You can see the biceps tendon separating the subscapularis tendon from the supraspinatus tendon. Now we're going to look at the supraspinatus tendon in long axis. Here's the biceps tendon, which you can see basically coming across, and the next structure back is essentially the very distal anterior part of the supraspinatus tendon attaching on the very rounded prominent superior facet of the greater tuberosity. Now we're going posteriorly. You can see how that superior facet flattens out into the middle facet of the greater tuberosity. It does have a mild hypoechoic subdeltoid bursitis, which you can appreciate here as well. It does have a cartilage interface sign, and there is some subtle hypoechoic signal at the articular surface of the supraspinatus tendon, and I believe this is a small articular-sided partial tear of the supraspinatus tendon. You just don't want to confuse that for anisotropy, so you want to toggle your probe and heel-toe your probe and make sure you're just not looking at normal tendon. Here again is that partial tear in a short axis view. You can see how this dark, almost anechoic signal going down towards the articular surface, consistent with a partial articular-sided supraspinatus tear. Here again you can see that black zone essentially within the tendon, which I believe is a partial supraspinatus tear. Now we're going to go ahead and look at the infraspinatus tendon, which looks normal. The thickness of the infraspinatus and subscapularis tendons, in my experience, seem pretty similar. So it looks like a pretty similar thickness to the subscap tendon, normal looking tendon. Now we're looking at the infraspinatus and teres minor tendons in short axis, and roughly the infraspinatus tendon is about twice as big as the teres minor tendon. And here now the two tendons are starting to converge with one another to form the posterior aspect of the rotator cuff.